Hello, everybody. So we're going to cover the Chapter 1 content that we would have covered on Monday that the university is going to be closed. So the first chapter is just asking what is critical thinking, clinical reasoning, and clinical judgment. So there's a variety of ways to go about this, ways to think about it. That we can start applying these things to our real life. So thinking versus critical thinking. Thinking refers to any mental activity. It can be mindless. It's just there. You're just thinking. There's really not a lot of purpose to it always. It's just there. Critical thinking has purpose and control. The best description is reasoning. So knowing to learn, common critical thinking descriptions is knowing to learn, reason, think creativity, generate and evaluate ideas, see things in the mind's eye, make decisions, and solve problems. So it's kind of basically using knowledge you already have to create a new way of thinking, a new purpose. And you're controlling the way you're thinking to come to a solution, usually to something. Reasonable, reflective thinking that focuses on what to believe or do. The ability to solve problems by making sense of information, using creative, intuitive, logical, and analytical mental processes, and the process is continual. Knowing how to focus your thinking to get the results you need includes using logic, intuition, standards, and evidence-based practice. So you can see there's many different definitions for what critical thinking is, but ultimately it's just using your experiences, the knowledge you already have, your intuition, what feels right, what feels wrong, to make decisions. All right, so a 20-year-old female is 2 days post-op abdominal appendectomy. So that means she's 2 days after surgery of an abdominal appendectomy. It means they went through her abdomen to take out her appendix. Her blood pressure is 90/60. Pulse is 133 and thready. Skin is pale upon observation. Patient complains of dizziness with movement. And she has normal saline in her IV running at 123 milliliters per hour. I know to some of you it sounds like I'm speaking a different language. However, this is information that once you get into clinical, you will be like, okay, this is what this means, and what can it lead to? And that's kind of how you're going to get into your critical thinking. So, what is your best nursing action? Well, her blood pressure is super low, her pulse is fast and thready, which means it's not a strong pulse, it's fast, the rhythm's not too great, her skin is pale, which is never that great. She says she's dizzy with movement. These are all drastic signs of dehydration, right? So we need to open up the fluids, which means run them a little bit faster than 125 milliliters an hour to replace her volume. Maybe reposition her to ensure primary organ infusion. Okay, why are we doing this? Okay, so you always have to explain why to your patients, especially if you want them to agree to do something. Tell them why this is beneficial. Why are we doing this? You don't just want to go in and start doing things to someone. That would make them scared, right? If someone just came in your room and started messing with your IV fluids or giving you medications or touching you without telling you what they're doing, it could be a very terrifying experience. So explaining, hey, we're going to increase your fluids so that maybe we can replace some of that lost volume, and maybe we can sit you up a little bit at like a 30 or 40 degree angle so that when you do move, you don't get super dizzy, that kind of thing. Explanations will get you far. All right, describing critical thinking, continued. You have clinical reasoning, which is CR, critical thinking, which is CT, and clinical judgment, which is CJ. So it's kind of a process that leads to the result. So the process is your critical thinking and your clinical reasoning. You're saying, okay, what can I do? Based on the knowledge I have, what can I do to fix this problem? What can I do to increase this patient's satisfaction? Okay, your clinical reasoning is, why am I doing that? And then that kind of all leads to the overall result, which is the clinical judgment, the decision that you made based on your critical thinking. Okay, describing critical thinking versus nursing process. So the nursing process is a model that promotes a competent level of care. So basically, this is a model that everybody is supposed to follow, so that way we're all kind of on the same page. And it kind of tells you the actions, the order of actions that should be taken here with each patient. Applied definition, thinking in the clinical setting. So moving on to the next slide, we can kind of go into the applied definition of critical thinking. It's guided by standards, policies, ethic codes, and laws, right? So individual states like Louisiana, which is the state McNeese is in that we are in, has specific practice acts. So if you get a nursing degree and a nursing license in the state of Louisiana, you have to follow Louisiana's laws, regardless of where you're at. It's because your license itself was given to you in Louisiana, following their laws. It can be driven by the patient, family, community needs, as well as the nurse's needs to give competent, efficient care. So you're using all of these things to critical think, right? If somebody has low blood pressure, okay, what is my hospital's policy for that? What do I do for that? Do I call the physician? Am I allowed to give fluids without an order? What are the standards of practice, the nursing practice, right? There's ethical codes, basically how you're supposed to follow a certain chain of command if things happen. Is it ethical? Does the patient know about it? Did they give consent? Is it doing more harm than bad? And the laws. And then it's also driven by the patient, family, and community, of course, because one, the patient has to understand what's going on as well as agree to the treatment. Their family is going to sway their decisions as well and what their beliefs are. Community needs. You have to remember, you're taking care of patients in a specific setting. However, they are going to be going home at one point, right? So if you're not doing home health, then you're doing something in a facility. And at that point, you need to ask, what are you able to drive? Do you have a car? Do you have family that can bring you to get medications? Do you have a safe home with air condition, running water, things like that? What needs do they have at home as well that's going to help them either thrive or they're going to end up right back where they started? As well as the nurses needs to give competent, efficient care, right? You want to feel comfortable in your decision making, using all the resources you can to know, okay, I'm making this choice and I really definitely believe this is the right choice for the patient. Critical thinking is often based on the principles of the nursing process, okay? Problem solving and the scientific method, depending on what exactly is going on. So this little picture is the nursing process. So you start with the assessment, right? You just look at your patient. What do they have going on? In that previous scenario, we can see that the patient's pale, right? We can see what the vital signs are. That's all part of the assessment. What's our nursing diagnosis, which you guys will get to when you get into clinical, but nursing diagnosis is more focused on what the nurse can do. It has a lot more to do with symptoms than a medical diagnosis. However, so that patient earlier, a nursing diagnosis would not be appendicitis. It would be more fluid volume deficit, altered nutrition, more symptom-based, because of the diagnosis that the doctor gave them. And then planning, what are we going to do about it? We did the assessment. We think we know what we need to do. What's our plan? How are we going to fix this? Okay, so our plan with the patient earlier would be to increase the fluids and reposition them. How are we going to implement? That moves us on to the next one. So we made our plan. Now we have to do it. Implementation means you're doing the things you plan to do. So we're going to increase the fluids. We're going to reposition the patient to be a little bit, to help with that fluid stabilization. And then at the very end, you evaluate. Okay, we assessed. We thought we came up with what was wrong. We made a plan. We did what we wanted to do. Did it work? That's your evaluation. Did it work? And if not, then you kind of have to start over and say, okay, what else can we do? Because it's not always a one problem, one answer type of patient. That's often not the case. So you'll have multiple nursing diagnoses that you'll have to make a plan, implement, and evaluate. Your focus on safety and quality. I can tell you safety is always the number one thing in nursing. Everything you do has to be done safely. This patient, if she gets up, if she tells you that she's dizzy every time she moves, are we worried about her getting up by herself? Absolutely, because what could happen if she gets up by herself? Feeling the way she does, she could easily fall, right? She gets dizzy, she could fall, she could injure herself, she could accidentally fall into somebody else. So we want to make sure that we're doing everything safely, making sure you're educating your patient. Hey, don't get up without me in the room. Make sure somebody's helping you up. Get up super slowly. You're constantly reevaluating and self-correcting and striving to improve. So there's a lot of cases basically everything in nursing is case by case scenario, right? Everybody reacts differently to different things. So you're going to have to say, okay, well, this is the goal we made, but it's not really working, or the patient's not tolerating it well. So we have to reevaluate and come up with something else. All right, critical thinking identifies key problems, issues, and risks involved. Okay, so what do we need to focus on? What issues do we have? What risks? Making sure that the patient, their families, and anybody else that's important is keyed in on the decision making early in the process. And then you're going to use your critical thinking, which uses logic, intuition, and creativity. Okay, so obviously this is something to remember, right? Logic, intuition, creativity. You've seen this every time I talk about critical thinking, so it's important to know that those three things are really big groundwork for your critical thinking in the experiences that you have. This is just a nice picture of what that's going to look like, the mind mapping. So you have triggers. What's our dilemma? What's our problem? What's our biggest thing that we need to work on right now? Starting points, intuition. So this is kind of where you start to say, okay, this is what's wrong. What can we do right now? What's our first thing that I need to do? So if my patient was the patient stated earlier, I would focus a lot more on safety at first, right? Your intuition says, okay, let me not leave this patient alone. Let me make sure somebody stays with her. This is that beginning thought process, that brainstorming of thinking, what can we do? What can our plan be? And then you kind of build onto that based on your knowledge, any skills that you may have, dispositions, experience, like life experience, like, oh, well, I had a patient like this before, and this is what happened, and this is how we fixed it. So you're kind of building on that starting point with your scaffolds. And then you have your processes, reflection and knowing, reflection and actions. This is that nursing process, problem solving, saying, okay, now I feel like I kind of know what's going on. Now we can start in the nursing process, making a plan, implementation, evaluating. And then your outcomes are going to be more of your resolution area, your clinical judgment, right, which is the decision that was made because of the critical thinking, and then reflective practice. So when you first start all this as a nurse, you're not going to be perfect at it. There's going to be a lot of room to grow, a lot of things that can change. So it's kind of important to reflect and say, okay, well, next time I think I could do this better, and so on. All right. Again, critical thinking is going to call for strategies that make the most of human potential and compensate for problems created by human nature. Example is finding ways to prevent error, right? Critical thinking, regardless, it's done by a human. Humans make mistakes. So how do we prevent a lot of these errors? A lot of that is going to come with a lot of technology, a lot of double checking, a lot of group work, because you may make a mistake as one human, but if you have a group of humans all thinking the same way, odds are someone's going to catch the mistake and prevent it from happening. That's why there's a lot of policies in place in a lot of the hospitals in the United States to help prevent errors from happening in the future. All right. Problem focused versus outcome focused. So you need excellent problem solving skills to achieve desired outcomes, results, right? So focusing on the problem, how do we fix the problem, and going from there. And then your outcome focused thinking aims to fix problems in ways that get you the best results. So are we focused on the individual problems so that they get better, or are we focused on the end result of what's happening? What about common sense? Some people are born with the gift of common sense, but there's a lot of it that's learned from experience. For example, 2-year-olds don't have a lot of common sense, right? Because they just haven't lived long enough to really understand all the things about the human experience. You can put someone with great common sense in a new or stressful situation, and you're likely to see behaviors that don't seem at all sensible. So there's a lot of people that come in, they're like, oh, I have a lot of common sense, so I feel like I'll be all right. Okay, common sense will only get you so far. You need to have a lot of that basic knowledge to back you up. Or you can have it the other way around, where you'll hear people say, hey, I'm really book smart, but I don't have a lot of common sense. And that's okay too. It's all about working on the things that you're not the best at, to become a better nurse, to become a better person. What do critical thinkers look like? So this is some characteristics of critical thinkers. Self-informed, inquisitive, open-minded. Open-minded is a really, really, really big one, because this is why we often do a lot of group discussions and discussion boards, because if you have a way of thinking, whether you know it or not, your way of thinking is pretty standard for you, based on your life experiences and the things you've done in your life, right? If you're closed-minded, you won't be available to listen to what anybody else has to say. You have to remain open-minded as a critical thinker to get you there. You have to face your personal bias, what you personally believe in, because that's going to change how you critically think. And you're going to have to be able to put a lot of that aside, or just be super aware of your biases to help yourself try to think differently. Willing to reconsider things. You're not super closed-minded. You're willing to make adjustments, focusing on specific details, persistent. These are all really good characteristics. So there's two kinds of thinking, creative thinking and critical thinking. And a lot of people will say they're either or, Creative thinking, you're, a little bit more willing to think outside of the box. And then your critical thinking is focused on a lot of truth, facts, evidence, things like that. Critical thinking indicators, behaviors that evidence suggests promote critical thinking. In your books, page 9, box 1-3, kind of goes over your personal critical thinking indicators. In real life, there's no ideal critical thinker. Like, there's no one's perfect. Everyone's going to think in a different way and have different ideas to bring to the table, which is why working in a group sometimes can be really beneficial. And in the hospital, you are going to work as a group. You don't take care of a patient by yourself. You work with other nurses, physicians, respiratory therapists, radiological techs, a bunch of different people, physical therapy, different surgeons, different fields of healthcare to work together to take care of a specific patient. And they're all going to have different ways of thinking. All right, your EQ is the ability to recognize and manage your own emotions and help others do the same. Speaking as someone who comes out of labor and delivery, yes, there's a lot of happiness, but there's also a lot of grief and anger that comes from that. You have to be able to manage your own emotions while you're working. You can be sad, you can feel emotions. However, you have to be professional about it and be able to work through it until your goals get met, and then you can really release everything. You have right and left brain thinkers. Right brain is generating new ideas, creative. It's more of the creative side. Your left brain is analyzing and judging the worth of those ideas. So just think the left side of your brain is always judging the right. Maximizing human potential, mapping to teach and learn, and changing how we view mistakes. Those things are always changing. What can be done, what can't. What's happening right now in the world that's changing the way we view things. It's all things that are never going to change. So it's like how you have already thought is going to continue, but it can change as you have more life experiences. You want to be able to prepare for what if scenarios. And this is something that's really coming to fruition in the nursing. That's why you have a lot of nursing diagnoses that are risk 4s. It's because it's basically a what if based on the patient situation. Evidence-based thinking. Evidence-based practice is always changing. It's basically what practices we are currently using based on previous research, the evidence that it's working, basically. And there's always new evidence-based practice coming out, so evidence-based thinking is going to continuously change. How we measure outcomes is changing. Is it just a goal? Is it how long are these goals for, etc.? And collaborative thinking, like I said, working together. to think through a specific problem, critical think together. This is an example. This is a 4-circle CT model. It just kind of brings in the different technical skills, the knowledge, and how it all comes together for your critical thinking. All right, putting it all together. So to improve critical thinking, be clear about what it entails in each unique situation. It's not being critical, it's accepting information at face value without evaluating whether it's factual and reliable. It's basically saying, I'm not just going to take your word for it, right? I need evidence, I need examples, I need evidence-based practice, I need personal experiences and what I've seen in the past. But remember, it's going to include all the other terms, your CR and your CJ. Putting it all together, remember your nursing process means to assess, diagnose, plan, implement, and evaluate, and it is the first tool to learn to think like a nurse. We had went over that previously. Critical thinking is like any skill. It takes time to get better, to improve. You all improve by gaining self-awareness, acquiring instruction, and practicing strategies to improve. For example, like I said, you're not just going to start out being amazing at critical thinking. You're going to need some experience as a nurse. You're going to need to experience some patients getting better, some patients getting worse, different cases, different scenarios. And once you gain all that knowledge, your critical thinking becomes a little bit better because you have something to go off of, a little bit more than your textbook from when you graduate. This is a good example of some questions to evaluate your potential for critical thinking. You have to be super duper self-aware of your current thinking practices. So really think, like, why do I think this way? What experiences in my life might have altered or changed the way I think? And then asking yourself some of these questions as well. So, to sum it all up, making sure we know what critical thinking entails, what it means to critically think, what it doesn't mean, clinical reasoning and clinical judgment, and how that all factors into critical thinking, making sure you understand what that means. That it's not the same. It's not something you can memorize and be great at. It depends on the context. Like I said, it's patient specific. Each scenario is different. Not accepting information at face value, making sure you're looking at evidence-based practice, learning at what has happened before, what works, what doesn't. And then just to end everything out, here's a quote from Albert Einstein. It's not that I am smart, it's just that I stick with problems longer. Meaning, you don't just find a solution and move on. We find a solution, we try it, does it work? Do you think there's something better? Let's try it again, and so on and so forth. So after reviewing this little document that I have just done with you guys, please make sure you go and fill out the discussion board that opens on Monday and closes on Sunday. Remember, if you didn't go over it in the orientation PowerPoint, you have to stick to the group that you are assigned for your presentations. You're going to post within that group and respond to someone in that group. So you need an initial response. You need an initial post that's your own, and then to respond to one other person in order to get all your points. Okay, if you guys have any questions at all, please let me know.